Hello, today I will be doing a demonstration on how to do an intramuscular injection. Before you get started, you want to gather your supplies. The supplies you will need for an IM injection will be your needle, a syringe, the medication itself, a gauze pad, alcohol prep pads, your Band-Aid. Before getting started, I just want to state today we're going to be using sodium chloride and our dose will be 0.5 mLs. Also, you want to check the expiration date on your supplies, making sure nothing is expired. Mine are fine. With that, you want to make sure that the expiration date on your medication is not expired as well. From there, you will go ahead and perform hand hygiene. Then you can assemble your needle and syringe. So when assembling your needle and syringe, you want to make sure that the syringe and the needle are on securely, so you just give it a little twist. We're going to draw back 0.5 mLs of air, and we will clean our stopper. And we're going to allow that to air dry before introducing the needle into the medication. And we don't want to introduce any alcohol in there. So we inject the air above the medication. We're going to invert and draw back our 0.5. Now that we have our 0.5, we will go ahead and use the scoop method one-handed to recap. And we want to make sure that we are hearing that click. So we hear the click, and then we do in fact have our 0.5 as our dose. Before going in the patient's room, you'll go ahead and perform hand hygiene once again, and you'll go over your 6 rights, and you'll also explain the procedure to the patient. So with your 6 rights, you're going to make sure that you have the right medication. We have sodium chloride. You want to make sure that it's the right dose. We do have our 0.5 mLs. We want to make sure that we are going in the right route. We are going IM, so that is the deltoid muscle. It is the right time for the patient to receive this. It is the right patient. It is the right circumstance, and we are going to document in the correct location. So we already performed our hand hygiene. Never hurts to make sure that our dose is correct again, and that our needle is on our syringe properly. So for today's landmark, we're going to use the deltoid muscle. So if this was our chromium process, we'll go 2 to 3 finger breaths below it, just depending on how big your fingers are. So this would be my insertion site. Also today I'm going to use the Z-Track method. I'm using this method. It allows the medication to go into the intramuscular tissue, and it does not allow it to seep into the subcutaneous muscle. So how we do that with our non-dominant hand, we'll go ahead and pull back on the patient's skin. Okay? So from here, we'll clean the patient's skin from inner to outer in a circular motion. Allow it to air dry. Take the cap off of our needle with our non-dominant hand, pull that skin to the side. We're going to insert at a 90-degree angle, dart method, 1, 2, 3. We'll inject our medication, hold it for a few seconds, 1, 2, pull out at a 90-degree method, and then we'll activate that safety lock on a hard surface, and then drop our needle in our sharps container. From there, you're going to go ahead and apply pressure with your gauze pad. If your patient is taking a blood thinner, of course, you'll apply pressure for a little bit longer. Once your patient isn't bleeding anymore, then you will go ahead and apply a Band-Aid. And that's how you give an IM injection. Thank you.